Bismillahirrahmanirrahim. Assalamu alaikum. Do you know that your kidneys work round the clock to filter 200 liters of blood each day, removing 2 liters of toxins, wastes, and water in the process? Simultaneously, the kidneys regulate fluid levels, release hormones to regulate blood pressure, and produce red blood cells via erythropoietin and help maintain healthy bones. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel Health Education. I am here to shed light on health topics that often go unnoticed and unspoken. Your kidneys are small but mighty organs that keep your body running smoothly. But what happens when they start to fail? When the kidneys are damaged, they may not be able to keep you healthy, and as kidney disease progresses, wastes can build to high levels in your blood and make you feel sick. Prevention and early detection of kidney disease is critical. Millions of people worldwide are living with renal failure, and many don't even realize it. Could you or someone you love be at risk? Imagine waking up every day feeling tired, swollen, and unable to think clearly. This is the reality for someone living with kidney failure. Let's talk about how to recognize the signs and symptoms before it's too late. Kidneys are vital to your overall health, but they often go unnoticed until they stop working. Early detection can save lives, and that's exactly why we are having this conversation today. In today's vlog, we are diving into renal failure, what it is, the warning signs you should not ignore, risk factors, and the steps you can take to protect your kidneys. Let me share with you a case history. Meet Mr. Ali, a 52 years old shopkeeper who had been feeling unusually tired for months. He often complained of swelling in his feet, difficulty concentrating, and loss of appetite. Despite these symptoms, he dismissed them as just part of aging. Over time, Ali's symptoms worsened. He started experiencing severe fatigue, nausea, and even changes in his urine. Sometimes it was frothy, and other times he noticed a drastic decrease in how much he passed. When his blood pressure shot up dangerously high, his family convinced him to see a doctor. After running a series of tests, including blood work, urine analysis, and an ultrasound, the doctor delivered the diagnosis chronic kidney disease, progressing towards end stage renal failure. His kidney function was severely reduced and toxins were building up in his body. The doctor also informed Ali that he was also suffering from diabetes and hypertension, which he was unaware of. His doctor explained that Mr. Ali's long history of uncontrolled diabetes and hypertension were the primary culprits. These conditions had silently damaged his kidneys over the years, and without regular checkups, the damage had gone unnoticed. Ali's treatment began immediately. He was put on a strict low sodium, low protein diet, prescribed medications to manage his blood pressure and blood sugar, and started a dialysis to help his body eliminate waste. The doctor also emphasized the importance of considering a kidney transplant is a long-term solution. Mr. Ali's case history is a wake-up call for all of us. Chronic kidney disease often goes unnoticed until it is too late. But with early detection, regular monitoring, and lifestyle changes, we can prevent or delay kidney failure. Key takeaways from this case history. Symptoms to watch for, these are fatigue, swelling especially in the legs or face, changes in the urine, nausea, loss of appetite, and high blood pressure. If someone has these symptoms, he or she needs to go to the doctor, get the checkup done to exclude or confirm if he or she is suffering from kidney disease. What are the risk factors for kidney disease? These are diabetes, hypertension, obesity, smoking, and a family history of kidney disease. And these are the risk factors which can put a patient in the danger of chronic kidney disease. There is importance of early detection by regular health checkups, especially if someone has risk factors, so the kidney disease can be diagnosed earlier on. The management tips are that you should control your blood sugar and blood pressure, eat a kidney friendly diet, stay hydrated, and avoid overusing painkillers. Renal failure is a silent killer, but awareness can save lives. If you are someone you know has symptoms like Mr. Ali's, don't wait. Seek medical advice today. Share this video to help others understand the importance of kidney health, and let's work together to fight this growing health challenge. Let's discuss important aspects of kidney failure in a learning sequence. Renal failure, also known as kidney failure, is a condition where the kidneys lose their ability to filter wastes and excess fluids from the body. There are three main types of renal failure. One is called acute kidney injury, and by this I mean sudden loss of kidney function. Second is chronic kidney disease or CKD, in which there is a gradual loss of kidney function over time. And this time is, most of the cases, years. And the third is end stage renal disease. This is severe irreversible kidney damage. And then renal replacement therapy is required in this stage. What are the causes of chronic renal disease or renal failure? On the top is the diabetes. If someone has got diabetes, the hypertension, high blood pressure, glomerulonephritis, that is the inflammation of the kidney filters, polycystic kidney disease, where there are multiple cysts in the kidneys, nephrotic syndrome, in which there is excessive protein loss, then drugs like NSAIDs, painkillers, few antibiotics, then toxins like heavy metals, pesticides, and obstruction if there are kidney stones or tumors, which is obstructing the flow of the kidneys, that can lead to chronic kidney disease. Symptoms we have discussed and we have noticed that these include fatigue, swelling, nausea and vomiting, confusion, abnormal urine output, blood in urine, pale or itchy skin, and muscle cramps. There are five main stages of the chronic kidney disease. It's not the time or it's not the nature of the vlog to discuss that medically, but just for info, the mildest form is the stage 1 chronic kidney disease, in which the kidney performs normal kidney functions, but there are risk factors for it. Then stage 2, mild kidney disease, stage 3, moderate kidney disease, stage 4, severe kidney disease, and fifth is kidney failure and end stage renal disease. How we diagnose somebody with chronic kidney disease? We do the blood tests like creatinine and urea. You do the urine test for protein and blood. We do imaging tests like ultrasound and CT abdomen. And of course, at times we need to take the kidney biopsy. The treatment is manifold. The conservative treatment include medications like ACE inhibitors, beta blockers, lifestyle changes, diet, exercise, fluid and electrolytes management. Then there is a mainstay of the treatment in the end stage renal failure, that is the dialysis, which is hemodialysis and peritoneal dialysis, and we will be discussing this in a separate vlogs very soon. And of course, the transplantation, the kidney transplantation, this is another option for chronic kidney disease. We'll discuss renal transplantation as well in the coming vlogs. What are the complications of chronic kidney disease? These are anemia, bone disease, cardiovascular disease, electrolyte imbalance, and infections. Your kidneys work hard every day to keep you healthy. Let's return the favor by taking care of them. Renal failure may be silent at first, but with awareness and early action, It is possible to manage or even prevent it. Your kidneys are your body's filters. Let's protect them. Early detection and prevention are the keys to fighting renal failure. Kidney disease does not have to be a life sentence. With the right care and awareness, you can take charge of your health and live a full life. If this video has helped you understand renal failure better, share it with your loved ones. Together, we can save lives by spreading awareness about kidney health. Share this message, encourage others to get regular checkups, and let's spread awareness. Do you have questions or know someone who might benefit from this information? Share your thoughts in the comments section below. Let's start a conversation about kidney health. Thank you for watching, and I'll see you in the next vlog. Stay healthy and take care. Khuda Hafiz.